Shoulder manual muscle test, middle trapezius. The action is scapular retraction. The origin is the spinous process of T1 through T4. The insertion is the spine of the scapula, and this occurs in the sagittal plane of motion. Adrian had a 5. Hip manual muscle test, glute medius. The action is hip abduction. The origin is at the iliac crest. The insertion is at the greater trochanter of the femur. This occurs in the frontal plane of motion, and Adrian had a 5. Spine manual muscle test, external oblique. The action is lateral bending of the trunk. The origin is at ribs 4 through 12. The insertion is at the anterior superior iliac spine, and this occurs in the frontal plane of motion. Adrian had a 5. Elbow range of motion, carrying angle. The axis of rotation is the anterior aspect of the elbow joint. The stationary arm is aligned with the midline of the shaft of the humerus. The mobile arm is aligned with the midline of the forearm, bisecting the radius and the ulna. Normal range of motion is 13 to 16 degrees for women and 11 to 14 degrees for men. Adrian had 14 degrees. Ankle range of motion, ankle inversion. The axis of rotation is the midway point between the medial and lateral malleoli. The stationary arm is aligned with the midline of the tibia. The mobile arm is aligned with the second metatarsal, and normal range of motion is 30 degrees. Adrian had 35 degrees. Spine range of motion, cervical extension. The axis of rotation is the external acoustic meatus. The stationary arm is perpendicular to the ground. The mobile arm is aligned with the nares or the bottom of the nose, and normal range of motion is 60 degrees. Adrian had 60 degrees.